My guest today is consultant orthopedic and specialist in joint replacement and arthroscopic surgery at Manipal Hospital, Bengaluru. I would like to welcome Dr. Chirag Thonse to the show. Good afternoon, doctor.
Good afternoon. Hi.
A lot of people these days complain of shoulder pain, not just elderly people. You also have young adults complaining these days about shoulder pain. They have issues around their shoulder muscle, around their neck thing. Tell me what it is. Is it about posturing or is it something bigger?
See, there are two elements with what you asked me. One is the pain in the shoulder, and second is pain around the shoulder. Now, when you look at a patient coming to you, the patient may either come to you with the pain which is diffuse, that is around the shoulder, or he could come with a specific shoulder pain. Now, one needs to understand that these are of different pathologies. Shoulder pain per se could be because of some injury, could be because of some strain in the shoulder joint, or it could be because of an wear and tear, or because of inflammation. Whereas pain around the shoulder, by and large, could be a muscular pain, or myofascial pains is what we usually talk about. That could be related to your posture, ergonomics, and things like that. So it's very important that we understand, is the pain coming from the shoulder or around the shoulder?
Dr. Chirag Thonse, you have been a specialist in this field. A lot of people don't know when to consult a doctor. So I am carrying a niggle here, and I am probably thinking that this is because I have not rested well. I need proper rest, proper sleep. So when do you think as a person should actually visit a doctor for if he is like suffering from a shoulder pain?
Absolutely. It's a very valid point what you've come across. We usually tend to neglect the joint and the body in the initial phases of our problems. So you need to understand that anything in any joint which causes pain, which causes instability, or which causes stiffness are a matter of concern. So the patients, when they come to us for any joint problems, can present either with pain, either with instability, or either with stiffness. Whenever these symptoms persist for more than 3 days, a simple sprain or a simple strain could be usually taken care of with simple painkillers, rest, icing, so on and so forth. But in spite of all these things, if the pain persists, if an instability in a particular joint persists, or if that joint is getting stiffer day by day, one needs to definitely get it evaluated by a specialist.
Okay. Now that comes to my next question. It's also about these days, a lot of people spend a lot of hours, several hours at stretch on a laptop. So the first reaction is like, okay, it might be something that's related to a bad posture, and if probably I will maintain a good posture and do probably 5 minutes of walk every 3 hours, 4 hours, all kind of knowledge that you get on social media. So if what you are suggesting today, Dr. Thonse, is that if your pain is persisting over 3 days or 4 days and it's a recurring thing, then you must visit a doctor. So you are suggesting that for a shoulder pain, or be it a knee joint pain or a niggle in my ankle, or is it like the shoulder pain is something that needs to be taken seriously? You can segregate between a shoulder pain or a knee pain.
No, it's any joint. Which the comment which I made earlier was generalized to any part of the body, and each part of the body reacts in a particular manner, like how a knee would react, how a shoulder would react. But these symptoms which I mentioned earlier holds good for any joint pathology, any muscular aches which is persisting more than say 3 days or 4 days, and in spite of rest and activity modification, you need to consult a doctor. Of course, it's a very valid point in today's urbanization. With the kind of a work stresses one has, the long working hours, it's very important that one takes care of the posture, because ergonomics and posture forms a very integral part of one's self-care and your body and your physical health. So it's very important that you maintain a good posture. That is another topic to deal with. But of course, we will be talking more of the shoulder injuries and pathologies specific to certain joints in today's program.
Dr. Thonse, what do you think are the most common shoulder conditions Indians suffer from?
Yeah, chronologically, if you look at it, I would segregate the shoulder problem into the problems which are encountered in younger individuals and the problems which are encountered in the geriatric population. Now, younger individuals come to us with shoulder problems, which are by and large related to their activities, sporting activities, or injury, fall, so on and so forth. Whereas the elderly population comes to us with either a shoulder stiffness, which happens over the period of time, which is called frozen shoulder, or wear and tear, which is called osteoarthritis. Now, the younger pathology, younger individuals come to us with the shoulder problems, which could be either a fall in the field while playing, either because of a road traffic accident, and an individual can have a shoulder dislocation. And when it is ignored, the shoulder joint can pop out again and again, which is called a recurrent shoulder dislocation. This is one of the very common problem why younger individuals come to us. Second, in people who are involved in a lot of overhead activities, like vivid swimmers, people who do a lot of overhead gymming activities, people who are involved in racket sports, they can have a repetitive stress injury and have certain tissues torn inside the shoulder, like the rotator cuff or a labral tissue tear, to be precise, labral tear or slap tear. Thirdly, in people who are involved in contact athletes or people who fall on an outstretched hand, can tear their rotator cuff tendon and can have weakness in their shoulder arm, and they can come to us for pain and immobility.
That's where my next question to you was, Dr. Thonse. What's a rotator cuff tear or an injury? I'll tell you why I'm asking you this question is because, like, around 10 years ago, I also had a fall while bowling, right?
Yeah.
And since then, I often, like, the pain subsides and it goes off. But whenever there's like a weather change or something, I feel a bit of like, okay, there's something that is bothering my right shoulder. So is that like people keep nurturing their injuries? They don't go to a doctor without even knowing that they have a problem. It can be, is that a rotator cuff tear or an injury? Will you describe it that way?
It's a very valid point in today's date. A rotator cuff injury or a frozen shoulder, these are two terms which are commonly used very loosely for any problems in the shoulder. Now, one needs to understand what exactly is a rotator cuff tendon. Now, we hear a lot of guys telling that I had a rotator cuff problem, I had this problem of pain, stiffness, so on and so forth. Rotator cuff tendon is nothing else but the end of certain muscles which arise from a shoulder blade and gets inserted into your arm bone. Now, there are four rotator cuff tendons, out of which three of them are very important, called supraspinatus, infraspinatus, and teres. Now, the main function of a rotator cuff tendon or tendons is to elevate the arm or to get the arm up against the gravity. Now, whenever you have an injury to the rotator cuff, an individual has pain, an individual has weakness in the arm, and he is unable to perform his normal routine activities. Now, as you said, you had a childhood or a adulthood injury where you fell off from a bike or would have had an injury while playing a sport. So you would have had either a complete tear of your rotator cuff or a partial tear of your rotator cuff. So the symptoms a patient could encounter is based on what profile of a tear the patient has. I would also like to add on a point here. Rotator cuff injuries are not restricted only to younger individuals. Most common patients who come to us with rotator cuff injuries are geriatric age group patients. What happens in them? The rotator cuff tendon tissue becomes weaker over the period of time as they age, and one fine day with a small trivial injury, they can snap off or tear their rotator cuff tendon and have weakness in their arm where they are unable to lift their arm by themselves. This is called a pseudo paralysis. They may need to support the arm with another arm to lift, or they can struck their shoulder and try to lift their arm. So this is also one of the most common shoulder problems which people come to us with.
There's an important question here. My mother, she suffers from a frozen shoulder. So is frozen shoulder a result of a rotator cuff injury or that is separate?
A second most commonly used term when people talk about shoulder problems. I
Because
mean,
she cannot lift her hand beyond a point and then she has to go through the exercise and all and then it subsides.
okay, let
But
me
I want you being a surgeon expert on this, tell me what would you suggest?
so let me just elaborate a simple point here. Frozen shoulder. means the shoulder is frozen. Now, what happens when you freeze something? It becomes tight, stiff, and immobile. A frozen shoulder leaves with a stiff shoulder, where the patient is unable to move the shoulder joint because the shoulder joint is stuck up. On the contrary, a rotator cuff tear leaves with the weakness of the arm or weakness of the shoulder joint, where if the patient is allowed to move the arm with assistance, like somebody else is moving the shoulder, they are freely able to move, irrespective of anything. A frozen shoulder can be result of a primary frozen shoulder, which is seen in individuals who are highly diabetic and in senior citizens, or it could be a result of a secondary frozen shoulder, which is related to some form of internal damage into the shoulder. So frozen shoulder per se can be either primary, which has no set particular cause. Diabetes could be a predisposing factor, or it could be a secondary frozen shoulder, which is a result of some other injuries in the shoulder. So your mother, if she is above the age of 60 years, and if she has not had a injury or a fall, and if she is diabetic, then it is a primary frozen shoulder. If she is non-diabetic, and if this is resulted after an injury to the shoulder,
Doctor.
yes, it could be a
Like she
primary
is
frozen.
that 6 HbA1c 6 around that borderline.
Okay, it could be a primary frozen shoulder.
Okay. Now, what would you recommend for a frozen shoulder or a rotatory cuff tear? You recommend a surgery to get it fixed, a permanent fix, or exercises, and like you should throw some light on it.
As you introduced me, I'm a surgeon, and I would always look at the benefits of a surgery, because surgery is
Okay.
the final destination treatment for any shoulder problems. But you have other alternative treatments before you probably decide on or go in for a surgery.
Correct.
Now, it all depends on what is the expectation of the patient, what is the profile of the patient, and what is the profile of the injury. Now, if it's a young individual who's coming to us with probably a dislocation of the shoulder or a rotator cuff tear, of course, the expectations are high. The patient would want to get back to its sporting activities. He
Normal.
wants to have a quick recovery time. Then a primary surgical intervention would be the apt treatment as early as possible. Get it fixed and get going with your work. On the contrary, in elderly patients, if it is a frozen shoulder, the first modality of treatment is always conservative. We put them on anti-inflammatories, we put them on some rehabilitation, physiotherapy exercises, wait and watch. If the
Okay.
symptoms are subsiding, if they're getting better, well and fine. A second modality of treatment are some injections, either a corticosteroid injection or a PRP injection into the shoulder in kinds of mild tears of the tendon. If all these modalities fail, then of course surgical intervention is the way to go
Is
for.
required. How critical is early detection, doctor?
See, a stitch in time saves nine. This is a very old saying, and it holds good for anything, especially in medical sciences. The entire logistics and entire finances and effort becomes less when a problem is detected primarily, when it is detected in the early stages. I mean, say for an instance, if you have a small rotator cuff tear, if it is detected early, it could be prevented from leading on to a massive tear. When we try to ignore it, push the pain beyond certain limits, think that it may subside by its own, I don't think it's a great idea, especially in today's date when you have so much of medical facilities available all around. You have so many good doctors, so many good hospitals. You have diagnostic modalities like MRI and CT scan, which can precisely diagnose your problem. And when you have specialists like us who can might as well treat your problem specifically, I think it's always better that you take a consult from a.
So now coming about, like you have explained the need of surgery and what are the options, what are the treatment options typically available for patients who come up with a rotator cuff injuries or probably a tear. So what are the treatment options available for them?
See, as I mentioned in the past, it all depends on the profile of the patient, the expectation of the patient, and the kind of pathology they present to us with. Now, if it is a young individual who comes to us with a complete rotator cuff tear, a minimal invasive surgery like an arthroscopy, a shoulder arthroscopy, a keyhole surgery, which would fix the shoulder. Yes, minimal invasive, a keyhole surgery. arthroscopy. Nowadays, we have moved on. The sciences are so advanced. A few years back, we would have to make a big incision, open up the shoulder joint, and repair everything. But in today's date, with the advancement of technologies and the medical sciences, everything can be fixed with a keyhole surgery. So, a rotator cuff tear can be well fixed with a keyhole surgery. This is a primary treatment when patients present to us in time. As I said, a stitch in time saves 9. Now, what happens if the patient neglects his rotator cuff tear? Over the period of time, the rotator cuff tear becomes bigger, the muscle tissues lose their strength and integrity, and then the length of the tendon tissue also shortens up. These are called as the irreparable rotator cuff tears. Now, when a patient presents to us with an irreparable rotator cuff tear, you cannot repair it. That means it's irreparable. Then you'll have to look into the alternative surgical options. Like we have certain patch augmentations in today's date. We have certain muscle advancement techniques. And what is in vogue today is something called as the balloon spacers, which are used inside the shoulder, which also provides a mechanical support and is beneficial in these kind of massive retracted rotator cuff tears, which are irreparable. To add on, when a patient comes to us with a neglected rotator cuff tear, which has happened many years back, and the patient is not treated in an appropriate manner, the shoulder joint undergoes a wear and tear, and that is the subset of patient who requires a shoulder replacement, particularly called as the reverse shoulder replacement, and that is the treatment lines for those patients.
What's the success ratio of the entire shoulder replacement? When you talk about the shoulder replacement, you talk about a particular, so like the entire shoulder. I'm asking a layman kind of a question.
Yeah, so when you replace any joint, we need to understand we are replacing only the involved surfaces of that joint. You do not replace the muscle, tendons, ligaments around that. You replace the ball and socket of the shoulder. And by and large, over the period of time, the technology is evolved. The materials and the implants what are used in these surgeries have advanced. And in today's date, you would say that the success rate of shoulder replacement surgeries are as much as 92% globally. So we have good results, what we call the midterm results of these shoulder replacement surgeries in terms of pain, in terms of mobility, in terms of patient compliance and patient satisfaction.
So Dr. Chirag Thonse, so what you are suggesting that if you have a pain, let's not wait for it to get worse and go to a point where you need a shoulder replacement, because before that also there are like minimum invasive surgery options that can actually help your rotator cuff injury, and that is where a lot of people delay things, and then there is a requirement of a shoulder replacement. Am I right, doctor?
Yes, yes. See, in
So all
any
those people who are listening to us, it's important for you to know that when you have an injury, it's like early, a stitch in time saves 9. Doctor just emphasized on that point. And before it gets delayed or worsens to a situation you need an entire shoulder replacement, you should visit a doctor, a surgeon, and get it consulted, get it checked.
Yes, of course. See, yeah, of course. So I mean, even before you would reach into a surgical interventions, I mean, if the problems are detected at a very nascent stage, if somebody comes with a partial rotator cuff tear, or else if somebody comes with the very early stages of sprains of the rotator cuff tendon, one could always avail the facility of a physical therapist, the physiotherapist, the strength and conditioning coach, and strengthen your shoulder muscles to probably avoid or prevent the further progression of tear. Regenerative medications, regenerative medicine in today's date is in vogue. People do have challenging results in regenerative injections into the shoulder, like PRP injections. They have healing potentials, and the partial rotator cuff tendons can also have benefits with these regenerative injections. So it's like an a la carte. You have different approach of treatment for different pathologies and what stage the patient present to us with. So the crux of the story is that one needs to identify your problem precisely in the right time to prevent any kind of a larger catastrophes.
Correct. One word that you also used was the balloon spacer procedure.
Yes.
can you throw some light, like again, if I may ask you to explain to our like viewers who are probably needing that kind of surgery, what it is and how you do it?
It is one of the technical advancements in shoulder surgeries. What is been seen in the last decade. It's a newer innovation in shoulder surgeries. What a balloon spacer does is, as I elaborated in the past, sometimes when the patient present to us, the patient is relatively young, the patient is active, the patient comes to us delayed after an injury where the rotator cuff tendon is irreparable. What are the options here? Either leave the patient alone like that and tell him come back after a few years to do a shoulder replacement, or do a premature shoulder replacement for him at a very young age. If the surgeon feels that the patient is too early for a shoulder replacement, the patient is active, a balloon spacer which is placed in between the shoulder joint and the bone above, which gives a mechanical support and helps in the shoulder mobility, can be an alternative option, or maybe a right option in today's date in such scenarios. It's a newer advancement of treatment in irreparable rotator cuff tears.
Does that balloon spacer stays in your shoulder throughout your life, or
Uh,
is it requires like a change or repair kind of a thing?
it's a self-degrading. It degenerates over the period of time. In the sense, it dissolves over the period of time. The
Okay.
typical timeline is 1 year,
Okay.
but
So,
during this phase, the patient has a mechanical support there. It acts like a spacer which recruits the muscles around your shoulder and regains the mobility of the shoulder joint. So I have been doing these surgeries and they've been quite productive and fruitful for the patients. I have results of
yeah, a lot
patients.
of people were very happy about the procedure that you have done, and I was reading your your patients' reactions to the surgery and the procedure.
Yeah.
So now, like, in which cases are shoulder replacement recommended?
Shoulder replacement, like any other joint replacements, the primary indication of a shoulder replacement is wear and tear of the shoulder joint. When your shoulder joint is worn out beyond repair, that is a grade 4 of osteoarthritis, is the primary indication for a shoulder replacement surgery. Of course, there are other indications, like somebody comes to us with a shoulder fracture which is not repairable, which we typically call it a four-part fracture of a shoulder joint. That's another indication for a shoulder replacement surgery. Thirdly, when patients come to us with the irreparable rotator cuff tear and the patient is not very young, so he can be offered a choice of a shoulder replacement, which is called a reverse shoulder replacement, which is the ideal treatment lines for
Okay.
these patients. So shoulder replacement surgery has got a spectrum of indications, among which wear and tear, that's osteoarthritis, irreparable fractures, and irreparable rotator cuff tears are the ideal indications for shoulder replacement.
What's the average cost of a shoulder repair surgery, sir?
I wouldn't want to comment on that because each surgery is different. The process is different. Each hospital has got their own rate tariff. But I should
Okay, that
definitely
varies on.
mention this, that in today's date, um, the kind of facilities which are provided in Indian medical fraternity and in the hospital setups are quite affordable to patients with
Okay.
good outcomes and good results, which are, I think so, which should be availed.
What do you think is the recovery period after a shoulder replacement surgery?
As I said, each shoulder pathology is different. Now, if you talk about a rotator cuff repair, ideally the patient could be up and about doing their normal activities by 3 months, and most of the patients are able to do all their overhead activities. If it's a younger individual, can get back to sports in about 4 to 5 months typically. But of course, if it's an elderly patient, you do not expect them to do certain things, so we restrict that. In a shoulder instability surgeries, like in sporting athletes who come to us with the shoulder instability and we fix the ligaments there, in those individuals the recovery is quite quick and they're able to probably resume their work in their sporting activities in about 4 months to 5 months typically. This is kind of the shoulder surgery recovery time we're talking about in a blanket scenario.
One more question, like frozen shoulder. My father few months ago was like diagnosed with a tennis elbow.
Yes.
Now I was amazed because only time I had heard about tennis elbow was Tendulkar's tennis elbow,
Yeah.
and then there were long articles like it happens to players who are like cricketers or players who are sportsmen and athletes. How common is tennis elbow elderly people?
See, tennis elbow necessarily doesn't mean that that it happens only to sportsmen. It's a day-to-day problem which can happen to anybody. The term why it's used as a tennis elbow is because of a particular backhand stroke. When you use a backhand in a tennis, you have this particular tendons which act and cause inflammation of that tendon insertion. So any movement of the wrist which is repeatedly done in this manner, probably riding a bike, typing your laptop, lifting some object in the gym, which is done repetitively, can lead on to a tennis elbow problem. And this is not restricted to, mind me, it's not restricted to sportsmen. It can happen to anybody. And the most common people who come to me with this problem are housewives or techies who are involved in a lot of typing.
That's a very important point, doctor, that you are making. A lot of people think that these are things that happens to athletes, sports persons. Like people don't get into the nuances of it. So, what is your message, or what would you like to share with patients and families facing shoulder injuries, or maybe osteoarthritis diagnosis? What would be your message to them?
Yeah, as a doctor's prospect of it, every pathology in the body or any problem in the body needs to be looked into with care. One needs to have a precise diagnosis and a right approach to the treatment. It's a world where you have a lot of information available online. You have a lot of online forums where you get informations, but do not get biased with these. These are all half informations. You need to identify a good specialist around you. You need to identify a good hospital around you, and of course, I would say make a couple of doctors your good friends so that you have right lines of treatment. It's very important that you avail the facilities which are available. We are all blessed to be in this era where you have accessible healthcare at moderate cost, and our leaders are doing enough work in this front. So we need to probably avail our facilities, get the right approach towards the treatment, and of course, be healthy and stay healthy.
Dr. Thonse, before I let you go, two questions. One is like what role, lot of people, I'm telling you, there's a sizable, like out of, you can say 50% of people suffering from a shoulder injury or a rotator cuff injury, they keep doing those traditional ways of like in India, there's a famous thing called malish kar diya, and then or you go to a spa these days, young people, and then they think that okay, they have got a relief and all. What would you like to tell all those viewers who are watching this today, who are listening to you, who are watching you today, like when do you, again, because I'm going back to that first question, like when to visit a doctor?
See, everybody has their role to play in medical sciences, right from a chiropractor to a physiotherapist, a sports science specialist, a gait specialist, gait analyst, a doctor, a nurse. Everybody plays their role. You need to identify who is the right person for your right problem. If it is a sprain, if it is a myofascial pain, you can see a, probably as you said, you can see a chiropractor or you can do some massage therapy. But in today's date, where you probably have access to a healthcare and diagnosis, if you think that you have a problem which is persisting, or if you feel that certain symptoms are not subsiding in spite of rest and so on and so forth, you definitely need to consult a specialist, get yourself diagnosed, and get yourself treated in the right manner.
Dr. Chirag Thonse, it was indeed a pleasure talking to you, sir. And on your behalf, I would like to tell all the viewers who are watching you, listening you, don't be your own doctor. Visit a doctor, and you must consult a doctor when you are facing such issues. If you have any more queries, please write to us in the comment section. We will try and get back to you. Thank you, Dr. Thonse. Thank you.
Thank you so much.